Hello everyone, I'll be talking to you today on one of the most commonest symptoms which the people present to the doctor, that is vaginal discharge or excessive vaginal discharge either during pregnancy, or it can be one of the most common gynae problem which people come up with. So first of all, we have to understand what a vaginal discharge is. Vaginal discharge is generally secreted by the glands in the vagina or the cervix, which is the mouth of the uterus, which generally tend to wash away the dead bacteria and the infections out of the vagina. So it's generally a protective discharge which is normally secreted by the body, and it's actually a normal discharge which is generally very common symptom. But when to label it is as an abnormal discharges when it is associated with lot of smell, it is associated with itching, or it is too much of excessive of what it naturally should be. A normal vaginal discharge can be excessively seen in cases when you are ovulating, when you are breastfeeding, or when there is a sexual arousal happening. But when either of the normal discharge generally can be normal whitish to a milky hue it already carries. But when it is more than the excessive amount, it is making the panty liners go wet, and you're always feeling a wetty feeling, and with a lot of odor and discharge and itching and irritation there, then we might have to label it as an abnormal discharge. There can be many causes for a vaginal discharge. One of the most common are the infections, which can be sexually transmitted infection like chlamydia, gonorrhea, trichomonas. There are various bugs which can cause this, and all the discharges which they cause can differ in type of color, the odor, and the irritation which they cause. The other reasons can be prolonged use of oral contraceptive pills. The other thing can be a prolonged use of antibiotic and a steroid use, which can lower down the immunity and can let the harmful bacteria grow up there. The most common of the discharge is a candidal discharge, which is a fungal discharge, which is more thicker, like a milky white discharge, more thicker in consistency and associated with lot of itching. It can be easily treated with a antifungal, but according to the amount of discharge, the infection there, we might need to give an antifungal for a prolonged period so as to help it attack or help it treat it for a longer period, because fungal infections tend to recur again and again because of the spores which they form, and they tend to persist for long. So they might need a longer course of therapy instead of just a single or small course of one, depending upon the amount of discharge. The other can be trichomonal discharges as well as the gonorrhea and chlamydia, which may require an antibacterial action or antibiotic cover, but depending to more specific according to the organism and according to the discharge and infection you have. Avoid, another one thing you can do is avoid using vaginal douches for long, avoid using a lot of feminine odor products there, lot of overwashing of the area, perineal area can also lead to recurrent infections there, because as when you wash with the good bacteria also. So the feminine hygiene products, when many are in the market, you should be using it to a limited amount. The other preventive things which you can do is increase the probiotics in your diet, which can help in getting the good bacteria back and which can fight off the infection by their own. So increasing the immunity by having a lot of fruits in your diet, keeping the hygiene there, treating and diagnosing first and treating them the right way is important. Injudicious use or self use of medication and treatment should be avoided.